First of all, I want to welcome all of you to attend today's event. My name is Valorie Anderson, and I'm the Executive Director of SFU's Vancouver campus. And welcome to Lunch and Learn. I want to acknowledge that our Vancouver campus, all of our 9 locations downtown, are on the unceded historic lands of the peoples of the Coast Salish, the Squamish, the Musqueam, and the Tsleil-Waututh. And let me just tell you briefly about what Lunch and Learn is about, and then I'll introduce our guest speaker for today. Lunch and Learn is an initiative based at the Vancouver campus where we showcase the research being done by SFU faculty members. And we present these several times a year, and we try to take a topic of research that has practical relevance for the public. And today's example, can't find perhaps a better example of that than today's topic and today's guest speaker. So that's the purpose of it. And the agenda for this is very straightforward. I'm just going to introduce our guest in a moment. And then after Dr. Valorie Crooks has done her presentation, then we'll be completely open for you to ask your questions. And as you can see there in the instructions placed up here, that what we'd like you to do is you could type your questions into the chat box is the first option. You can use the raised hand function in Zoom, and then we can unmute you when it's time to talk. And we will accumulate the questions. A question may come up as you're listening to the presentation. A question may come up, you can put that in the chat box, and then these will be held until the Q&A is finished. So it's fairly straightforward, and that's the plan. And so let me just introduce our guest today so we can hand things over to her. I'm very pleased today to welcome Dr. Valorie Crooks. Valorie is a professor, full professor in the Department of Geography at SFU, and she's been with the university since 2006. She holds the Canada Research Chair in Health Services Geographies, and she has a Scholar Award from the Michael Smith Foundation for Health Research. Her areas of research broadly are disability and chronic illness, primary healthcare, palliative healthcare and social care, and finally medical tourism. But what you probably all know Valorie for is what I know her for and what my colleagues know her for is the work she's doing right now with the pandemic. And she's been in the media a lot covering this, and I do want to say now, and we'll do it again at the end, thank her so much, and her colleague Leah, who have joined us, for taking the time to be with us. We're very glad to have her here today. She's going to share some information, and then it will be over to you to ask your questions. So please take this opportunity to engage with our Lunch and Learn today. So with that, I turn things over to Valorie. Welcome, Dr. Valorie Crooks.
Thank you very much for that welcome and introduction, Lori. I'm here in my house in Maple Ridge, of course, a faculty member at SFU, and Maple Ridge is home to the traditional territories of the Katzie and Kwantlen people. In today's presentation, as was just alluded to, I'm going to talk about some recent research that I've been involved in with regard to mapping, modeling, and COVID-19. I'm very, very happy to be here. And also, before I move forward, I'd just like to point out that joining us today and moderating the chat is Leah Rosenkrantz, who is working with us in this project. She is very exceptional in her knowledge of this project and is able to also answer some of the more technical questions. And so with that, I'm going to move forward and get going. And I look forward to the dialogue as it unfolds after this presentation is finished. So as was already mentioned in this presentation today, I'm going to be talking about a project that I've been involved in leading that actually has a whole team of people lending their expertise that's been focused on mapping neighborhood vulnerability to COVID-19. You may have actually seen reference to or a newspaper article about or a TV news piece about this project. We shared the findings more publicly in late December and actually used the information that we received from people to help us inform, shape, and make some decisions on our next directions. And actually, I'll just mention that in this presentation today, for the first time, for those of you who are here, I will be sharing the next steps in this project. So you'll have a chance to actually be the first to become aware of where we're headed with this work. I just wanted to start off to acknowledge that never did I think that I would be involved in giving a presentation on vulnerability modeling related to a pandemic. Like most people here, I was surprised, shocked, concerned about what I saw unfolding early in 2020. In fact, I was visiting at a university in Seoul, Korea, at the point in which flights started to be canceled and rerouted, and I had to leave the country. I wanted to point that out because my initial response to the pandemic was like that of anybody else who's attending today's talk. I was concerned about what this meant for myself, for my family, for the health of others locally. And that sort of initial response then led me to sort of think about things as a researcher, a health services researcher with a background in addressing various health service issues, including transnational healthcare mobilities, and say, well, now that I see how things are moving forward, maybe there's something I can do to lend my research expertise. And I felt that this sort of mindset was forming not just in response to my role as a health services researcher, but also in my positioning as a geographer. Because I am a health geographer, my training is in the discipline of geography. We might not initially think of this pandemic as being an inherently geographic problem or issue, but in fact it is. In this slide, on one side of it, you can actually see the cover of a new book that's coming out. I'm not here to talk about it, but it's an edited collection of 60 chapters that actually help to show how COVID-19, this pandemic, and our responses to it are actually geographic processes, structures, and impacts. But one of the things we mentioned in this introductory chapter, and this is the quote that you see on your screen, is that in many ways, not only is this an issue that many health researchers have felt connected to and felt that they can address and provide new insights on, but also social scientists have as well. And so with my work sitting at the intersection of health science and social science, I think that as with some of my other health geography colleagues, the timing was right to really step forward and to show how a geographic framing and a geographic approach to thinking about the pandemic can assist with shaping the information that's available and the solutions that we can offer to the problems that we've been experiencing. So I was actually quite surprised. Also, never did I think I would be talking about, I think, what Oprah termed the aha type of moment. But yes, one happened for me in relation to this research, because again, I was thinking that perhaps I can and should lend my skills, do something. And then there it was. A call came out from the Michael Smith Foundation for Health Research. For those of you on this presentation who are not familiar with them, they are a BC-based health research funder. And they put out a call for rapid responses to the COVID-19 pandemic and the development of projects. And one of the specific targets for this call, and you see this on your screen, is that they were looking for proposals that actually address human geographic considerations in British Columbia, including rurality, community culture, and population movements, with a view to dealing with prevention and mitigation. I have to say that as a health geographer, it is not every day that I see a research call come out where there is a specific request to address it using a geographic framework. So hence the aha type of moment. And this is when things started to crystallize in my own thinking, and when I reached out to my ongoing collaborator, Dr. Nadine Sherman, who's leading this project with me. She's also somebody who I've collaborated with before. And I was thinking, well, perhaps we can sort of build on existing work that we've done. So what you see up here are some maps and discussion. This is not about COVID-19. For the last decade, Dr. Sherman, or Nadine, and I, we have been collaborating, looking at creating health service siting models with a focus on palliative care in British Columbia, looking to figure out what we can do to use a geographic approach that could assist us with enhancing palliative care provision through thinking carefully about where services should be enhanced. Now, when you hear me say that, again, nothing about the pandemic really resonates necessarily, but this idea of creating a model to help to identify communities that we need to focus on is where this sort of parallel idea first emerged in response to this call from the Michael Smith Foundation for Health Research. And so with Nadine, we created a project, which is what I'm here to talk about today, where the goal was, and you can see it here on your screen, it was to produce, or is to produce, a series of maps that really help to identify specific locations in British Columbia that are at risk of experiencing potentially high rates of COVID-19 infection. The other parts of this goal statement are referring to aspects of our project that we're still working on. So a second one refers to spatio-temporal access to healthcare. So really identifying communities that are distant from major health services should there be an outbreak in that area or in the community. And the third is to look at, as well, identifying places where being vulnerable to the secondary health effects of the pandemic. And I'll speak more to this at the very end of this presentation, where we can actually create models, and as an outcome of these models, maps that can be used as decision support tools to assist with providing this information. So the objectives of the research that we proposed were to create and run new vulnerability models. So actually 3 different models that we call the Corvix models. That's internal speak. Nobody here needs to refer to them. But again, just lifting back the curtain and letting you know that's what we call them in our project. If you look at email subject lines, it's all about the Corvix with us. So we were looking to create models that could generate maps that could assist as a decision support tool. And I just want to signal that that's a very important aspect of our project. We've never conceptualized that these maps alone should result in policy interventions or decisions being made with regard to what's happening in particular communities. We've always conceptualized from the outset that these maps would be used in conjunction with other sources in order to provide a more refined sense of what we can think about using a geographic type of approach and how we can understand differentiation at the neighborhood level across British Columbia when it comes to this pandemic, what's happening, and what potential interventions can occur. The second objective is that we wanted to use an approach where we could actually refine these models in an ongoing way based on new information as it becomes available. And I'll let you know how we've done that so far through the work that we've done on our first Corvix model. And then our third objective has been to dialogue with end users, so basically key decision makers, to actually get feedback on how the models can be improved and also how the results of these models actually should be shared with people, including what kind of interpretive guidance we should be using. And again, I'll talk briefly to this in the presentation today and how we move forward with that objective, which has actually been through undertaking targeted key informant interviews throughout working on creating the models and therefore the map outputs. The other thing that I'd like to signal is that up to this point, I've been talking about the proposal as we pitched it. So basically the idea that we put forth to the Michael Smith Foundation for Health Research. And I mentioned that one of their priorities actually in this call for funding was around human geographic considerations. And I'm really pleased to mention that as far as I'm aware, our proposal was the only one funded that identified this as its primary focus of the research. So all of the other proposals actually touched on other aspects of the call. But the other point that I wanted to make here is that in addition to the funding we received from the Michael Smith Foundation for Health Research, we also received supplementary funding from what is referred to as the BC Support Network, which is a network that supports patient-oriented research. And they came to us and said, well, you've got this interesting time-sensitive project. You're wanting to have feedback on this throughout, and you want to prepare results that are actually going to be able to be shared widely. Why don't you take a patient-oriented approach to this? You could incorporate patient partners on your research team and get input that way. And so as a researcher, I said, well, that's something new that we could do. And so we agreed. And we also have 2 patient partners joining us, whose names I included on the title slide, Paul and Christy. And Paul and Christy have been working with us, on this journey, providing really critical feedback and assisting us in particular around language and messaging, as well as how we visualize these results. So that sort of brings you up to speed in terms of where this idea came from and why it is that we're doing what we're doing. So now what I'm going to do in the remainder of this presentation is focus on what we internally know as Corvix 1, but what you know as, hey, that website that I happened to see mentioned on the news or that I read about, it's the one that's shared in the chat link. And so if you've yet to see it, you're welcome to click on it and follow along as I continue with this presentation. And this model, what I'll talk about now, is essentially the process through which we developed it. One thing you'll notice on the website, if you have looked at it already, is that we have not shared many technical details, nor have we shared a method section. And one of the reasons that we did that is that we did not want it to read like a research paper. That's actually our comfort zone as academics. I would just like to make that absolutely clear. If we wanted to have tons and tons of technical details, I have to say, I can see Leah's face on this slide right now and she would absolutely agree. We could have just done it up. And instead, what we did was we shared what we would like to consider maybe or call interpretive details, giving people guidance on how to think about what they're seeing. And then my email address is included at the bottom for anybody that has any technical questions. It's been wonderful. Of course, I'll share later in this presentation that following public outreach, we have had lots of people follow up, some of whom have actually asked more technical questions. And so we're really pleased with this strategy of having a website that is really aimed at providing information on interpretation and allowing people to get in touch with us about technical details has worked out so well. So with that in mind, I'm going to share more of this overview of how we did what we did and not the technical details of the GIS side of things, because once again, I'd like to invite you, if this is what you're here to hear about in this lunch and learn session, please follow up with me by email, and we're happy to share those details. So in terms of the process of how we ended up creating the model or the maps, depending on how you want to refer to them, and ultimately what you see on this website, it involved 5 key steps. And I just want to point out as well that right here in the image that you're seeing on your screen, it really kind of demonstrates or visualizes these steps as a linear direction where one leads to the other. The fact that they don't actually show bidirectional feedback is more of a limitation of my own PowerPoint skills than actually what happened, because there are many aspects of this process where we came up with something that actually took us right to the start, where we had to find evidence again, or where we had to zoom forward to think about how that could be visualized. So I just want to make this clear that I've shown this visualization here, but that this process itself actually involves a lot of bidirectional feedback loops. So the first step in building the types of maps that you see on the website that we've shared is that we had to come up with figuring out what variables do we actually want to include in our model. I'm actually in a coming slide going to show you the full list of variables where we started our conversation. It was really nice to go back for this walk down memory lane and dig those up and think about where we started our conversations in July, August, and September, and where we ended up in December. But really the basis of creating a model along the lines of what it is that we've done in these maps is that we need indicators, we need variables to include. That is the core of creating a model. So we had to figure out what variables we would include, and we did that through carefully reviewing the existing scientific literature, as well as popular and media discussion coming out to show us what kinds of factors actually are being linked to risk in relation to COVID-19. The second step, and I just want to make it clear that, again, this is one box on a screen with lots of arrows. This is a process that took us a significant amount of time. We were continuously reviewing literature, talking about things that were happening in British Columbia. We have to keep in mind that at the point at which this proposal was originally submitted, things were heating up in New York City and were on fire in Italy. By the time that we were creating this model, our understanding of the pandemic, of COVID, and changes in our everyday lives here in British Columbia were so radically different. So then the next thing that we needed to consider or do in this process was actually figure out data links. How can we visualize a variable? And actually, that's something that's really important in that it's really an inclusion criteria for this type of model. If we don't have a way to gain access to data to visualize that, then it's not something that we've incorporated in this model. So we've really used 2 types of data. One are census data that are available publicly, And the other are addresses, where in some instances we actually looked up the actual address of all the locations of, for example, prisons in British Columbia and included them in our maps. The third is that we had to integrate variables that kind of went through those first two steps into the model. And this is not necessarily as straightforward as it sounds, because we wanted to make sure that, for example, variables that we were adding were not resulting in us sort of double counting particular kinds of aspects. We also wanted to make sure that variables should not be collapsed or potentially removed because they were redundant. The next key step in creating these maps in the model was to seek feedback from key informants, which we did through the process of interviews, as well as other feedback that's come to us since we've made our maps publicly available. And then finally, we refined the model based on feedback that we got, as well as the maps themselves. And we shared them widely. It's very funny, you know, the world of research and the pace at which things are moving in relation to this pandemic is so drastically different than what many scientists are used to. When we submitted the proposal and received funding for this, we actually hadn't thought through what mechanism will we share these maps through. So ultimately arriving at what you're seeing, which is the link that's shared in the chat, and it's a style called a story map. It is something that's a great fit for what we did, but this is again something that we made a decision on based on feedback coming from key informants. So I'm not going to talk through all these variables. I wanted to put them up on a list to say, this is where we started. The first thing we did was went to the literature and said, what are the variables that are coming out in the literature internationally that are linked somehow to COVID-19 risk? If you look down these variables, you can see that some of them are reflections of certain points in time. So for example, wildfire smoke, there was concern about, you know, exposure to pollutants, to particulate matter in the air, and to people's vulnerability to developing COVID-19 as a result. That's one example that really shows the temporality of this list. Early on as well, we heard a lot of discussion around smoking. This is discussion that we don't hear as much now. So I've put this list up to show as an example that this is really how we started. We looked in the literature, and then we took a list like this through that process that I showed in the last slide and kind of said, where can we go? Where are the data? What do we want to see? What does this look like? Is this redundant? Is this repeating? Is this meaningful? Is this still consistent with where our knowledge is and what it is that we want to show? Something that also came as we started to sort through these variables was really a critical moment in our thinking as a group, which is that we really came to the realization that we had gathered two types of variables. Again, something that you may have expected that we knew from the outset, but in fact, it was something that was another one of those aha types of moments for us. And more specifically, it's that we realized that we were collecting variables that dealt with risk for people. But then we were also collecting variables that dealt with place-based risks, which we've ultimately conceptualized as place-based amplifiers as we were moving forward in our work. And this was a critical moment in our thinking of creating the model, because we actually realized that the model in the end actually needed to have these two components figured separately. So risks to people and risks inherent in places. And we needed to bring these together to create our overall assessment of risk in terms of across neighborhoods throughout British Columbia. There's no need to understand any of the specifics on this screen. I'm putting this up here again as a walk down memory lane. These were really the first maps that came out that showed this pivotal moment where this was when we first ran the model and realized that we were heading in the right direction. So by considering personal risks and these place-based amplifiers, so you can see those in the blue and red maps, and then bringing them together into the purple map was the right direction, where the purple is our overall model and the red and the blue are the main components of it. So again, another critical moment for us. We were headed in the right direction. And by this point, we had whittled down that list of variables that I first showed. So the list of variables that was very long, those are not all of the ones that are in the model. When you look at the website, you can see really clearly on the left-hand side, which variables are ultimately included for each component of the model. And again, I'm trying to give you the background of how we got there so that you can understand some of the science behind what it is that you're seeing in the news. So the next key step for us was to undertake interviews with key informants. At the point at which we started, our story map, so our web version of this project was not ready. It's not that we hadn't thought about doing a website, we just hadn't necessarily made a decision, nor did we want to independently make the decision that a website was needed. One of the goals of this project was to do interviews with key informants who are people who use this kind of information in supporting decisions in their work roles to find out, is an interactive website useful? Or would you prefer to have stationary maps such as what you see in front of us? So you can see here again on the right-hand side in this instance, in terms of the people-based factors, this is where we started with as we were kind of visualizing this model. You will see a difference between the variables that you see on the right-hand side and what you see on the website. And again, this is showing you these significant changes that we've made over time. So some of these were collapsed, others of them were removed as a result of the key informant interviews that we did. Again, this is where we started with our place-based indicators, and we've had so much conversation about these indicators over time, because this is where a lot of the conversation is coming out from the media, coming out popularly or publicly, and where sometimes that was happening before even there was recognition of a particular risk environment within the scientific community. And so these were the variables that we first had in place once we took our models to key informants to say, help us figure out, is this right? Is this useful? Is this what you would like to see? And then finally, again, this is what the original output of the model looked like, where this is what we went to decision makers about. This is how we started our interviews. And after our first few interviews, it was very clear that there was overwhelming support for the idea of putting this in a web interface, something that's searchable by place, something that people can scroll in and out of. And so I want to mention this because our interviews and our process of interviewing itself was something that involved changes over time. We would do a few interviews, and I know I mentioned key informants. Here we're talking about people who are public health practitioners in their jobs, key healthcare administrators, senior healthcare officials within health authorities. And so after talking with 2 or 3 people, we would come back to the team to say, all right, what did we learn? A lot of what we were hearing was about the visualization as opposed to the components in the model, though we did make some changes based on what we were hearing about 2 indicators in particular. So we were hearing that this is what we needed to do. So actually, by the end of our interviewing component or our interviewing phase, we were actually showing people the earliest version of the story maps of what it is that you're seeing in the website that you see there. So within the span of about I think about 3 weeks of when we started interviewing to when we created the story maps, that was kind of our time to ramp up, get the feedback, know that this was the sort of mechanism through which. And that was also sort of that learning curve where we learned that what we really needed to do was get information from those we were speaking with to tell us what kind of guidance we need to share with other people about how to interpret the results of these maps. So from the key informants that we spoke with, there's kind of 4 lessons that I would say we gathered as a group. So first is that the interviews really underscored for us the need to have an interactive map website, that this was useful and that this is something that could even be shared widely in addition to those who are in key decision-making people. The second key lesson that we got from these interviews is that it really informed our thinking about what kind of guidance we needed to give people, and I'll share what that is in a moment. And in fact, this is the guidance that you see in those first few paragraphs at the top of the map. The third thing that it did was really help us shape our own thinking about what we were trying to show and why. These, again, are hilarious behind the scenes kind of conversations that you have as a research team. I want to say that, at one point there was one component or one map that I retitled probably 15 times because I was flipping back and forth in my mind. Are we showing this or are we showing this? Are we showing this or are we showing this? And actually, through going through that process, it gave us a lot of clarity on what we were doing. And I don't want to make it sound like we don't know what we're up to, but where we started and where we ended were two very different realities. I've already even shared the difference between when this proposal was being written and when we started actually undertaking the research. So it really solidified us in terms of really becoming clear on what it was that we were doing. And then finally, it did push us to refine our thinking about two of the variables that we were considering with regard to inclusion in the model. So ultimately, based on those interviews, based on our own conversations, including having patient partners working with us on this team who were really focused on helping us understand public consumption of this research and what kind of details and information we needed to share, we realized that the key kinds of guidance, so these are the messages that we want people to know when they're looking at the maps, needs to include these 4 points. So first off, and we've said this to ourselves as a team so many times, all models have limitations. In fact, all models are wrong, really, because they are actually based on including assumptions based on the best science that's available. But typically a model does not end up being 100% accurate. And so, we were never concerned with having 100% accuracy with regard to this model, which might sound unusual to people that are listening, that are viewing science as happening in a particular kind of way. But in fact, we know that models are wrong, but they can be useful because they help to signal certain things. And I'll give you some examples of these all models are wrong and how this was played out in my conversations with people with sharing these maps. And so this is one of the reasons why we really wanted to enforce that people should be using these maps in combination with other information sources. Another sort of key aspect of the guidance that we wanted to share is that we are aware that we had limitations with regard to the data that were available through Statistics Canada. And so second to that, here we use a Statistics Canada unit known as the dissemination area to represent neighborhoods in our model, which again is a point we could spend all day talking about, which I'll just, because of that, move on to our next point, which is that, and most importantly, we do not want people to use this model to attribute blame for transmission to specific people or specific places. That's not the intention of what we've done. And finally, something that I haven't mentioned that is an important point, and we've talked about this a lot as a team, is that our models use a business as usual approach to the variables. And what we mean by that is that if certain business sectors were closed, we didn't ultimately remove them from the model, because we need to keep them in so that way it helps us understand if the interventions that have been put in place are useful. And I'll just clarify what that means in a moment. So this is what you see in the maps that you're able to look at in the website that's being shared. I'm just showing this up here on the screen to show you that as of now, this is where we've taken this project. We haven't been changing the variables. We're still tweaking our language on the maps that you see on the website itself, but this is where we ended up with this project. So you're able to see the variables that are included on the website that you have the link to. You're able to click on any one variable to isolate it and take a look at it. I think it's quite natural that people are going to do that for their own community. If you haven't done it already, you're welcome to. And again, you can isolate any one of these variables. So then this is where we ended up with our place-based, and you can see the long list of places actually that feature in this model or this component of the model, again, indicative of how our public knowledge regarding COVID-19, what's happening here in British Columbia, as well as the scientific community, has really changed over the course of undertaking this research. So then, this is the model. This is the result of combining those last two into a single visualization that shows relative vulnerability to COVID-19 by neighborhood. And the relative notion is really important because, in fact, we've kind of grouped overall vulnerability into these 4 categories, and we look at the risks in a neighborhood relative to the province as a whole, in order to sort of assign it to one of these 4 groups. And then after getting to that point, it's kind of funny to see me on my own screen here, but I just was wanting to put together some clips just to show you that in late December, in fact, it was December 24th, we shared these maps. We had a huge conversation in our team, and this was the point at which new variants were coming on the scene. There was discussion with regard to vaccination rollout. As a team, the science side of us said, we could change this, we could change that, we could do this. The citizen side of all of us said at some point we have got to drop anchor and and sort of share these publicly once we're at a point where we're comfortable, which I have to say is not a typical kind of decision in a research project like this, where typically we would have shared these within the scientific community first, going through peer review, submitting them to journals. But again, the pace of that is not consistent with the pace of informational needs in a pandemic. If we had have submitted this first to a peer-reviewed journal, we would still be waiting for reviewer comments. We might not have anything in print for a year plus, depending on the journal and its own timelines. So as a result of sharing our maps publicly, and including the night of the release, we were featured, is you can see the image of myself there. That's just a screenshot of being carried on global news on the night that the maps were shared, which was really wonderful. We did get public uptake of them. And then as a result, this is how I spent from December 24th until probably early January, the first week of January or so. This is just an icon of a flaming email inbox. I don't mean flaming, sorry, in terms of hate mail. I mean flaming in terms of an inbox on fire. We had so many people reach out, asking informed questions, intelligent questions, sharing concerns, wanting to understand how to interpret the maps, telling us about uses that they have for it, asking us questions about interpretation, asking us if we were going to do this in other provinces. There were a few people who were very concerned about what they saw in their communities and wanted to understand why. There are, like with any sort of scientific project, some people who just don't see the reasoning for this work or believe that this kind of strategy is not founded. And so I just had so many interesting conversations over my isolated pandemic holiday. So actually probably no better time than to have a flaming email inbox. And so through that process, we actually made some changes to our maps and really refined some of the key points that we wanted to share. And one of the key points that I was getting across in all of the media coverage, as well as in emails with people, was that one of the key takeaway messages that we would like people to have from this mapping project is that it is very important for us to understand where risks exist outside of where we see COVID-19 cases. Because if later on the information, the data get released with regard to more geographic granularity with where cases have emerged, and if we pair them against the work that we've done and we find that actually some high risk locations actually had low numbers of cases, this is very useful for us to know, because one of the things that's pointing out is that the public health interventions are actually working well. So I know many people, in their feedback, they were hoping that we would actually share COVID-19 cases on here. But as I was explaining, this is why we have shown what it is that we've done here. I'm going to conclude this presentation with a little bit of forecasting to the future. If you're interested in seeing more of our work, the best way to make sure you're going to get access to it, I guess, is to follow me on Twitter. And this is just showing that the next step that we're working on in this project is to actually look at identifying neighborhoods where people are likely to be at risk, health risk, of the pandemic at large, as opposed to contracting COVID-19 specifically. And this is simply to acknowledge that there will be many health effects coming from the economic, social, and policy measures that have been put in place that are going to result in the kinds of outcomes that you see listed here on the left-hand side: housing insecurity, job insecurity, occupational burnout, loneliness, isolation, educational disruption. These are all outcomes that can have significant health effects. And this next step in our modeling project is attempting to serve as a reminder to people that once the last case of COVID-19 in British Columbia is no longer active, we're not done with dealing with the health impacts of this pandemic. And with that, I'd like to open it up to questions and thank everybody who has attended today. Sorry. Sorry about that. You would think I would know how to do it perfectly by this point in time, but I lost the image on my screen. So yes, thank you. So if you have questions, just enter them into the chat screen. I know Leah is moderating the chat screen, and any questions that can come for a larger discussion, I know Leah is going to signal those ones.
Valerie, we have a question from Holly in the chat, and it's, have you spent much time with the BCCDC data dashboard?
We have looked at many different kinds of dashboards and many other mapping projects, including those not specific to the COVID-19 pandemic. And one of the useful things in the interviews that we did conduct is that some people pointed us to other dashboards to take a look at. The BCCDC one, which I know we looked at, and I think I was actually looking at it again today, is done using a dashboard, if you want to call it, making software called Tableau. And ours is using ArcGIS. And so there are ways that the visualizations between these two. So effectively, these are almost, the way to imagine them are like different word processing programs. If you were going to write an essay, where you can go for A or B, and different ones have different features. And so, yes, we have been pointed towards the BCCDC one. We've looked at it. We have had people point out features on that one that they have felt could be useful in ours, but they cannot be picked up in the story map software that we've used. Oppositely, there are things that we've been able to include in our dashboard that are not available in the one that you see for the BCCDC tool.
Thanks, Valerie. Another question from Kelsey is, do you know if this mapping is happening in other provinces?
Yeah, that's a really great question. I have to say that was the first question my mom asked because my parents live in Southern Ontario. Our project right now and what we're focused on is dealing with Ontario specifically, is dealing with British Columbia specifically. Since undertaking this work, we have joined up with other people that have formed a large national team to create a network around vulnerability modeling. We have spoken with, and Leah was part of that conversation with somebody in Quebec that is looking to do something quite similar to our project and was coming to us for some particular kinds of examples. And so we hope that the project that we've undertaken is useful to those in other provinces that are undertaking this work there, but this particular model is not being applied elsewhere that we're aware of.
Thanks, Valerie. Another question that Lori has asked is, could you please speak to your last point about there being ongoing issues with COVID, even after vaccinations? And I think this refers to our second set of models coming out.
That's right. So our first model is really focused on COVID-19 specifically, but there are larger health effects from the pandemic more greatly. And so, in fact, there will be many people who will have experienced some sort of impact to their health as a result of the pandemic who have never contracted COVID-19. They're part of an economic sector that has experienced closures, shutdowns, rollbacks, et cetera. Parents who are experiencing burnout, stress, where that is being sort of actually drawn into long-term health effects. And so this is what we're referring to in the next model that we're working on.
And another quick question, is your research funded until its natural end, or do you have to reapply to proceed? And that question's from Diane.
Thanks, Diane. That's a great question. So the project that we were funded for is a one-year project. So we have this funding in place until it runs out. as far as I'm aware, there's not going to be necessarily a reapplication for this specific stream of funding that was brought about for an exceptional purpose. But as this project moves forward, we may be able to identify other sources of funding. And I've already alluded to the fact that we've joined a large group of researchers who are interested in these same type of issues, who have submitted a large multi-million-dollar grant to a funding agency known as NSERC. That's the Natural Sciences and Engineering Research Council of Canada, for forming a network around this, so that we can all use our skills and experience from this current context to help increase our pandemic preparedness in the future. Probably more information than you wanted to know, Diane, but happy to talk about research funding any day.
Great, thanks. This one's from Carissa. You mentioned a bit about your model showing where public safety measures are working due to a difference in cases/exposure than what your business as usual model is. Can you give a specific example of this that is particularly noteworthy in BC?
I would love to be able to give a specific example of this. A lot of the information with regard to COVID-19 cases has not been given at any degree of geographic resolution that would allow us to offer this kind of comparison. We're hoping that as things move forward, once we get to a point where British Columbia is not experiencing potentially what some may have called, at least initially, a small numbers type of problem, which is not a bad problem to have when you're in a pandemic, I would like to make absolutely clear. Once we get out of that kind of situation, and those numbers become more available, and again, our map is showing neighborhood level, and so in fact, we may never see that information coming out comparably with regard to COVID-19 cases. So unfortunately, I'm not trying to talk around your question. The short answer is we don't have the data to be able to offer that comparison. But our hope is that those people who do have the data, who have access to it and where it's not being shared publicly, can look at that contrasted against the modeling in our work as well as others to help to see where interventions have been successful.
Another question we have is from Elisa, which says, was there anything that you have learned with your research that is surprising to you?
That's a great question. I've certainly learned a lot myself in terms of being involved in leading a project that is so time sensitive and of the moment, where there are many people who have very set viewpoints, and also some people in the research environment who believe completely that their approach is the only way, or is the superior way, as well as butting up against some of the politics around data access, around if and how we can share our models with other groups, and people feeling territorial, in fact, about these types of modeling projects, where these are things that are not part of my normal purview. I've never been involved in this type of modeling, and I have to say that there are very few people that are interested in the palliative care modeling that we've done earlier in terms of a politics around that. And so these are things that have been really interesting, especially that territoriality, with some groups actually feeling as though they sort of owned the right to do what it is that we've done, although they didn't do it or do it in the same way that we did. We are, as independent researchers, able to pursue this research that is funded by the Michael Smith Foundation for Health Research and was reviewed by a panel of experts, including experts who represent a number of key healthcare and public health agencies across the province.
Another interesting question that we've had come in from Aphrodite talks about the capabilities or assets, and whether we can visualize this as a layer to show the spatial indicators or factors, for example, types of social infrastructure or organizations that allow communities to minimize risk. And Aphrodite says that this might be interesting as we assess the impacts of pandemic after the immediate health crisis, and we are dealing with the longer term socioeconomic impacts.
I agree, Aphrodite, completely. This is actually a conversation that we've had within our team. And, part of what I mentioned in terms of when we decided that we felt ready to share these models publicly was kind of getting to a point where we said we could keep going, but maybe we need to share this because of the state we're at with the pandemic. One conversation that I don't think we have resolved yet, but we don't have a solution to how to incorporate it, is that we have considered actually if and how we could incorporate incorporate resources, which is really what you're talking about here, into this model, or potentially create another model. We've had a number of brainstorms around this in our research group, including with our patient partners, and this is an ongoing part of our dialogue. So your point is incredibly on point with regard to what we've been thinking.
We have another question. This gets a bit more technical, and it's from a member of the Niagara Region Public Health Team. And they've asked if we've experimented with other levels of StatCan geographies, custom neighborhoods, to assess the modifiable aerial unit problems. And I'll speak to this one. So we've worked at the dissemination area level, and that is so far the smallest unit that StatCan data is available. And so we don't actually get into what is called the modifiable aerial unit problem, which is basically that when you group people together at different areas, you might visualize patterns differently. And we don't actually get into that problem because we are using the smallest available. So it still might be a problem at that level, but there's no smaller level that we can go to visualize our data for our census data, at least. Are there any other questions?
You know what? I don't see any other questions coming up. So I'm going to share with everybody what the most common question that came to me once our maps were shared publicly, which was very interesting. Many people wanted to know why the dissemination area that contains Stanley Park was actually showing up as a higher risk area relative to other areas. And just to give you an example of the kind of conversations that I was having with people, you know, the dissemination area for Stanley Park includes the high density apartments and condominiums that line the park. As well, there are some economic activities that happen within the park, including restaurants, bars, etc. So I just thought I would share with you, just to give you a little bit of insight in terms of the kinds of questions that we received, just to show you actually the level of curiosity that people have had and how closely people looked at our maps, which as a research team that's been undertaking this work, I have to say has been incredibly rewarding. I've appreciated every conversation, and I've also appreciated every question that's been shared in this chat, some of which are things that are still ongoing dialogues among our team. So I'd like to thank everybody who's been here today, and I'd also like to thank Leah as well for moderating and answering that technical question that I would probably sweat out having to do so myself.
Well, Valerie, thank you so much. And there's a number of people who've put comments there thanking you from across the country, some of your colleagues in Ontario. So we've had such a great comprehensive group of people have come along today. First of all, Valerie and Leah, thank you both very much. We can't imagine how busy both of you are right now. And to take time out like this at lunchtime to do this, we really appreciate it. Thank you so much. Secondly, I want to thank my colleagues, Kelsey, Alyssa, Sophie, and Claudia, who do all the work behind the scenes to make this happen. They're part of the SFU Vancouver team, and they are responsible for Lunch and Learn coming to you. And finally, I want to thank all of you for taking the time on what is one of these few sunny days we have to spend it indoors learning about geographic mapping. So thank you so much. It tells us how important it is. So again, to Valerie and Leah, thank you so much. Please keep looking out for the SFU Vancouver website for our next Lunch and Learn. And we'll close now, and thank you so much. Bye-bye, everybody.